Good evening and welcome. You're watching Left, Right and Centre with me, Sanket Upadhyay. This is going to be a continuous coverage of what could possibly be a third wave of the pandemic in this country. Very, very alarming statistics. For instance, the cases in Mumbai on a weekly basis, that is on a 7-day average, have seen a 50% jump, 50. And the cases in Delhi over a period of 1 week have seen an almost 100% jump, which is why the time to act is now. A lot of things needed to have been done that have not been done. For instance, a crucial decision on booster shots, on improving the testing, improving the genomic sequencing, lots of things, wearing of masks, and most importantly, and this is a question we'll continuously ask of governments who are trying to preach to the rest of the world, to the rest of the country, that you contain yourself, form containment zones, don't go here, don't celebrate Christmas, don't do that. Yes, people should not. But at the same time, these politicians must also answer a crucial question. Why are you allowed to go and attend political events and rallies? Is there some special study where COVID is not going to affect you or all those participants in your election rallies? Why should there be different strokes for different folks? The worst part of the pandemic, is it ahead? Bill Gates called it the worst part of the pandemic. And are we prepared for COVID 3x? Only yesterday, the central government has said that their study shows that this latest variant is 3 times more virulent than Delta. Don't look at percentage of hospitalization. By the sheer population, the size of our country, imagine the number of people in absolute numbers who will need hospitalization. The time to act is right now. In fact, the time to act was yesterday. Let's act right now. What are the curves that have been announced? Let's take a look at this presentation.
Another year, another muted year ending, thanks to the COVID-19 virus that does not seem to be in any hurry to leave. As Omicron cases steadily rise in the national capital, the Delhi government banned all gatherings to celebrate Christmas and New Year. All cultural events and other gatherings have been prohibited. Meanwhile, parts of NCR, like Gurugram, are still looking at the spirit of Christmas, with families and friends thronging to the malls. However, those in the hospitality and food business say they are already staring at cancellations due to Omicron.
We all are very scared. I know this is going to impact the business once again. I mean, this has been happening all year round, since last 2 lockdowns also. The business downtrend has already started. There have been a lot of cancellations. People have actually cancelled their travel plans also already.
Delhi has banned public gatherings for Christmas and New Year's, keeping in mind the threat posed by the new variant Omicron. But in the rest parts of the national capital region, such as here in Gurgaon, public spaces are decked up in the spirit of Christmas and New Year's, but authorities say that they will be very careful with the public adhering to COVID protocols.
In Karnataka, large gatherings are banned from December the 30th to January the 2nd. In Bengaluru, for the 2nd year running, the usual crowd gatherings on Mahatma Gandhi Road and Brigade Road of the Central Business District has been banned. No big events are allowed to see in the new year in hotels or in housing colonies. No events with DJs, and clubs and restaurants can only operate with 50% capacity with fully vaccinated staff. Christmas is not really affected, at least for now, with mass being allowed and gatherings in churches being permitted as long as COVID protocols are followed. In Mumbai, ahead of Christmas and New Year festivities under the Omicron cloud, the BMC ordered that prior approval from the local disaster management authority is needed for any gathering, even in an open space, for 200 people or more, until further orders. Until last weekend, the permission was necessary only for gatherings with more than 1,000 people.
New Year celebrations will of course looks like to be in low key. The 144 recent clampdown, although it doesn't affect the hotel and restaurant operations, is kind of leaving a sense of doubt and in the minds of the people as to what is going to happen. But let me tell you, the industry is fully geared up and all protocols are being fully followed in every restaurant and hotel.
With officials calling for strict and prompt action before cases hit critical thresholds, more curbs cannot be ruled out. With Pooja Bharadwaj and Shonakshi Chakravarti, Maya Sharma for NDTV.
All right, let me introduce our guest this evening, Dr. Rajiv Jayadevan, Vice Chairman, Research Cell of the Kerala State IMA. He's also member of the National IMA Task Force on Coronavirus. Dr. Shashank Joshi, member of COVID-19 Task Force in Maharashtra. And Dr. Brahman Mukherjee, Health Data Scientist. Thank you very much, Dr. Mukherjee, for joining us. Let me begin with you first. I saw a tweet of yours, Dr. Mukherjee, where you said that these are the 10 things that we can do, which can perhaps save us some bother in this wave. Would you like to discuss a few?
Yes, thank you, Sanket, and thanks to be invited on this panel. I think that what research has shown over and over again, that the timing of intervention matters. We cannot really wait to act till we see the surge. So some of the recommendations were definitely based on the Omicron data to scale up vaccination for the unvaccinated, but also consider booster doses for the most vulnerable. The second thing is really data. Nimble and transparent data on case trends. For example, are we seeing cluster infections? Are we seeing infections in the vaccinated increasing? What is the rate of reinfection? Really enhance genomic surveillance and epidemiologic surveillance, and not just focus on international travelers, because what we can see from the United States and all other parts of the world, that Omicron is there in India, and we really need to scale up our game. And I think that it is really unfortunate that we are only focusing on the mildness of the data, of the other data sets that we are seeing, but not really thinking about the transmissibility, the sheer number of infections one could have if there is a high rate of breakthrough and reinfection. Then even a small percentage of people falling sick will lead to an absolute number of hospitalizations, which is could be very large. So I always believe in a middle road. Panic is bad, but prudence is something which should really guide us. So those are some of the 10 recommendations. But, we sound like a broken record, that these are known things and it's time to implement and translate them into reality and action.
All right. Dr. Joshi, before I come to you, there's a graphic presentation that we have prepared on where we stand as far as our testing is concerned. I remember right from March 2020, a lot of stress was put on testing. So as of this moment, let's go full frame so that our viewers can see. Time to rapidly increase COVID tests. The basic COVID management 101 is to detect more people. So the first little peak that you see was the COVID testing, 7 lakh tests per day. This was just before the first wave. And then in the second wave, you saw it peak 20 lakhs tests per day. But it is almost half of it right now. Dr. Joshi, do you feel that now, since we know that we can test 20 lakhs, I only assume that we would have built on our capabilities. Now is the time to ramp up the testing. The earlier we test and detect, the better our chances are to control it.
Absolutely. But Saket, you need to take, this is an RT-PCR data. And remember that in the rapid antigen test came in a little later. So currently a lot of self-testing is happening with rapid antigen tests. And therefore, and that is not being transparently reported, because a lot of people self-test, and even if they are negative or positive, they do not tell. Definitely there is a need to scale up testing. But remember, right now we are at the lowest ebb of our second wave. Consistently in the last 4 weeks, we have seen the numbers which are the lowest, between 5,000 and 6,000. Clearly there is a need to ramp up testing, no question asked about it, particularly the RT-PCR testing. But the self-testing also has dented these numbers. And if there is a suspicion, it is the winter time, flu and cold time. In COVID times, COVID test is mandatory. Don't delay the test and retest again after 3 to 5 days. So that is clearly there. So we have to be vigilant, and we have to diagnose and self-isolate and prevent the spread. That is clear cut. So I don't see any major challenges from that standpoint. But currently there is active virus in circulation. When there is active virus in circulation, particularly in geographies like Kerala, geographies like Maharashtra, northeast of India, and various other states, and we are seeing a little upscale across India, including New Delhi, a small little speck which is coming up. Clearly we need to up our ante. We clearly need to up our vigil, And there is nothing wrong in upping our vigil and increasing our testings. No question asked about it. And also we need to encourage people to self-test because there is self-testing available. This has been a tool which has been used in different parts of the world. And I think it's important to recognize that they have to protect themselves. We also need some degree of cooperation from people at large, that they need to be serious about COVID. There is still active COVID in circulation, though it may be predominantly the Delta strain. There is some Omicron around there. But I think we need to get them back. And currently people are still into a celebratory mode, revengeful mode, rebellious mode, and fatigue. That needs to break down. They need to be a little more cautious, careful, and protect themselves, protect their near and dear ones, protect their states and the country and the world. So I think it's very, very crucial that people do that and behave responsibly. So that's clearly the need of the hour. And clearly I agree with you completely that we need to step up our testing. But for that, voluntary participation of people at large is as important as our public health agencies to do sentinel surveillance. And that also needs to be upped in different parts of India, across India, particularly with the wedding season around the corner, festive season around the corner. And
election season around the corner is the biggest challenge. I know I don't want to ask you political questions, but what do you do? This is crazy. I mean, every rule seems to be applicable to every citizen of this country, but our politicians who would go ahead, continue with their rallies, public meetings, no questions asked. I mean, lead by example. It's not like COVID is not going to spread in an election rally. Dr. Jayadevan, let me come to you now on the question of testing. You see, the studies so far, which are not conclusive, but still the studies so far reveal about the Omicron variant that it is, up until now, causes milder symptoms, or many people are asymptomatic. Some have recovered also. In a situation like this, many of these people who are asymptomatic would not want to get themselves tested. Why would I want to get myself tested if I'm asymptomatic? Thus increasing the chance of this asymptomatic person, given the fact that Omicron is far more virulent, affecting many people who are not, who are symptomatic and, who have comorbidities. Thus dangerous.
Yes, as you rightly said, Omicron is a fast spreading variant. If there is anything definite that's known about it, there's no doubt that it is fast spreading, which means that if there are people who are gathered in a closed room, almost everyone is going to get it, whether they are vaccinated or not. And that is the anecdotal experience that's accumulating rapidly from around the world. We've heard about that 74% secondary attack rate that happened in the restaurant in Norway, where 110 people attended a Christmas party, and all of them are fully vaccinated. 74% got infected. So many of these people got, in fact, symptomatic infection. We are tuned into thinking that Omicron or COVID-19 in general is an asymptomatic disease in about 40%. But in that particular series, what is interesting is a remarkably high number of people who turned out to have symptoms. So the question is the kind of exposure that they're getting, is it different? For example, in a closed chamber, when there's a lot of festivities, a lot of singing, cheering, talking, conversation, yes, there's plenty of aerosol load in the closed room, and it generates plenty of viruses and can get inhaled directly into your lungs, as opposed to a casual exposure outside. So that's one. The second thing about your question is about testing. Yes, willingness to undergo testing is a limiting factor, and availability of the right test, as Dr. Joshi rightly pointed out, all these are factors. But let's just move a step backward and look at that statement that you made in the beginning. You said different strokes for different people. Now I'll build on that. COVID-19 is not a vaccine preventable disease. It is not a vaccine treatable disease. This pandemic is a game of strategy. And strategy, as Dr. Mukherjee said, vaccine is just one part of the strategy. And now let's look at the broad-based strategy of, there are basically two-pronged strategy. A, to prevent infection, and B, to prevent people from dying should there be an infection. Now we know that 2 doses of vaccines are excellent at preventing people from dying. If you look at the data from CDC, we know that 2-dose and 3-dose have exactly the same rate of death over the past month. So there's no doubt that 2 doses that people got in our country are excellent at preventing deaths. Now let's look at infections. So that's where the question of boosters come in. Boosters largely boost your antibodies, and so they make it less likely for you to pick up an infection. Now there are other ways other ways you can reduce the risk of infection. One, by not attending that social gathering that you were invited to. Maybe choosing to meet the person outdoors, or maybe having a video conference instead of an in-person meeting. Wearing a mask. Now that's where I'll draw your attention to that statement you made. Different strokes for different folks. Now there is a humorous take on ourselves that we ourselves make about the adherence of rules in India. Rules are meant for other people. Now, when it comes to COVID-appropriate behavior, people need to understand that COVID-appropriate behavior is universal, as you rightly said. It has to be followed by everyone. It is not for a select group of people, and it's definitely not for other people. It's for yourself. As Dr. Joshi said, one must isolate at the slightest hint of symptoms. One must isolate first and get tested, get diagnosed, and inform your contacts, and that's the way forward. This is going to be a long journey, and there's no easy solution.
Yes, Dr. Mukherjee, let's now talk about the vaccines. Now, there are conflicting studies. You've got the latest Lancet report, which now says that AstraZeneca wanes in about 3 months. Now, that's an extremely alarming study, because here you have got a version of AstraZeneca which has been largely applied to or administered to so many Indians, and the government is yet to make up its mind on booster shots.
So I think that, one thing which has bothered me throughout the pandemic is actually how decisions are made and how data-driven decisions are made. So if the data from India has to be contextualized to say that, okay, yes, other countries have decided to go for booster, but we do not need boosters yet because the second wave was so widespread, and we have a combination of natural immunity and vaccination-induced immunity. We need to get that contextualized data. So the Imperial College study really worried me, as Dr. Jayadavan mentioned, that it does not worry me as much that we'll have lots and lots of infections if they're mild. But the study actually showed that the protection of the vaccines against Omicron in terms of severity even goes down. Sitting in Michigan, I can tell you that it feels like a viral blizzard. So many of my friends are falling like pins in terms of symptomatic infections. Some of them are fully vaccinated with 2 doses, but not boosted. So I do think that prevention and data-based decision is really important here. And it also bothers me that data paucity, data opacity, and data denial does not help anyone.
True.
Transparent scientific communication from the government, if there is a decision not to promote boosters, even in high-risk individuals who have gotten vaccinated in June and who are elderly, have comorbidities, or healthcare workers, if there is a decision, then there should be science behind it. I also feel frustrated that even after being boosted, I have never gone out without masks. I have always maintained the COVID protocols, but my outcome, my life is very diminished because of behavior by others. So this spillover effect, we have to take collective social responsibility.
Correct.
And the public and policymakers have a role to determine public health.
We are at our own mercy, and we are our best judge. We are the best vaccine. Our mask is the best solution. All these things, I know Dr. Joshi, Dr. Jayadevan, Dr. Mukherjee have been saying for the past many, many, many years. Just can't say it enough. The time to act was yesterday, but it's still never too late. Thank you very much for joining us. And politicians must apply this rule to themselves as well, as they are gallivanting around the country campaigning for elections. All right, my next guest is Mr. Atish Taseer, author of, a very famous author in fact. Atish Taseer is also, I think, mended from the COVID-19 latest variant. Is that true?
Yeah, I mean, I'm in my last day of isolation. But as your previous guest said, viral blizzard, that's very much the atmosphere that we're living through right now.
Atish, you see, when you look at experiences, I saw your reaction also where you said today is my penultimate day of isolation after Omicron. We were vaccinated, many of us boosted, a dozen people got sick at a birthday last Friday. There is really no defense as of this moment, do you feel? I mean, with even the booster shots, something like this is happening.
I feel very much like that. Like 10 days ago or 12 days ago, this felt like a normal city entering Christmas season. People felt quite secure. Many people in the city had been boosted, and we were all tested before going to this birthday. And literally it was 12 people who got sick, and everyone like quite sick, like a terrible sore throat, a hacking cough, days of sort of chills and sweats. And so it a lot of the things that people say about previous variants, loss of smell, taste, that weird metallic stuff, that wasn't there at all. But it's the feeling is that here is something where everyone gets sick at once. And that's kind of a terrifying prospect.
And, but not everybody has the same immunity level. You may have some people who would be able to weather this storm, and there'll be others who could very well end up in hospitals.
Absolutely. I mean, I really feel like we were suddenly all running for the exits. And I who had been like, kind of like, oh, one has to learn to live with this, and we have to be able to go out and have a Christmas season. Suddenly I was like, no, I mean, cancel everything. I'm going to just sort of hole up in my house and kind of wait this out, because it's not really possible to function if I'm 41 years old, and if I'm getting that level of like illness, one feels very, very afraid for senior citizens, for the unvaccinated, for various different communities, people who are immunocompromised. So like it really has been difficult to continue.
Now, one crucial part of your message towards the end was take it seriously. I mean, isn't this a message which is for one and all, especially at a time when all of us are pandemic fatigued?
Right, absolutely. And one, obviously, I was listening to what you were saying about the efficacy of AstraZeneca and other sort of non-mRNA vaccines against this stuff, and election rallies and wedding seasons. And my feeling was I was really kind of had my heart in my mouth as I was listening to you talking about these things, because I thought if this stuff is going to peak in India in February, it's really it's such an onslaught, and you have this window now to really get serious about it, because I mean, we're facing a kind of collapse here. Like, we can't get tests, we can't get testing results. We're doing home tests, but like medical care is very hard to come by, and this is quite an industrialized society with a lot of medical facilities and a lot of tools, and despite that, we're completely flattened by this thing. So yeah, no, absolutely. I would say take it very, very seriously while you have the chance.
All right. Thank you very much for joining us, Atish Tasir. His message is loud and clear. Take it seriously. Thank you. Thank you so much for joining us, and wish you good health. All right. Let's take some questions that have been sent to us by our viewers on the KOO app. On the KOO app, many of our viewers have written. Here's one statement: those below the age of 18 years who are unvaccinated could face the wrath next time. That's a comment. Let's take a look at the next comment. Will there be another wave bringing with it a new set of challenges? Well, a wave might be closer than you think. Look at the way cases are increasing. In Mumbai, they're up 50% in a week. In Delhi, they're almost 100%. The Prime Minister has called for a review meeting tomorrow, where experts fear that there could be an Omicron-triggered third wave.
Behind these obscured doors and windows are some of Delhi's Omicron patients. These measures have been taken to protect their privacy. Access is strictly restricted to healthcare workers in PPE suits.
We have got approximately 3 or 4 patients till now in last 2 to 3 days from the home isolation facility itself. So that time it was a different story. It was only from airport. But now we even get calls from the home isolation centers, that we need the patient to be admitted to your facility.
Delhi has just reported 125 new cases of COVID, the highest in over 6 months. And the third time there have been over 100 cases in 4 days. Test positivity rate in Delhi is still only 0.2%. although it has the highest number of confirmed Omicron cases. But doctors warn that this could be the beginning of a rapid spread.
The absolute number of individuals in India who are still vulnerable, either because they don't have adequate immunity or because they are elderly and have high-risk medical conditions and haven't been boosted, that absolute number of individuals is quite high. If Omicron variant causes milder disease, the sheer number of infections because of increased transmissibility can overload the system.
The centre has called for emergency action if a district's positivity rate crosses 10%. As per latest government data, only 2 districts in Mizoram meet this threshold. The Health Ministry has called for emergency action even before the threshold is met. There are 22 districts in 7 states that are reporting test positivity between 5 and 10%. In Assam, Kerala, Manipur, Mizoram, Rajasthan, Sikkim and West Bengal.
As Omicron cases are spiralling and so is the anxiety surrounding a third wave, the Prime Minister is expected to chair a high-level meeting tomorrow to discuss the threat and preparedness for this variant of concern. With Pooja Arya, Meher Pandey, NDTV.